We're here for our white coat ceremony where we welcome our new interns to the hospital. We have 29 new interns this year. We have 5 in the area of family medicine. We have 5 in the area of internal medicine and 10 transitional interns that will be here for the completion of 1 year.
Well, it's very important to the hospital and to the students. It's really the kickoff of when they go from their didactic training to their clinical training, and then they stay here for, depending on the program, anywhere up to 3 years to complete their clinical training before they become physicians in a community and practice medicine.
Our interns are selected through a process where they apply to our program. And then the applicants are reviewed and sort of weeded through. We bring in the applicants locally to interview that we feel meet criteria for the program. And then based on the interaction with the interview and the fit of that particular person with the program, they are either offered a position or not.
Well, there's a set number in the program, total 44. We have 24 that are traditional rotating interns that will stay here for 3 years, and then we also have the 1-year interns that come here to do a specialty service later on, such as a neurologist, a pulmonologist. They'll do fellowships after they leave here. So the first-year students will be here only for 1 year.
Our interns spend most of their time in the hospital directing patient care. They're rotating with medicine attendings, and they are also spending time with all the subspecialists in the hospital. So they'll rotate through nephrology, neurology, hematology, oncology, all the medicine rotations. They are involved in surgeries in our surgical suites. They cover our emergency room, as well as any emergencies or rapid responses that take place up on the floor. We have coverage 24 hours a day, 7 days a week, so we always have physicians in-house taking care of the needs of the patients.
A lot of hard work. So they'll have a lot of hard work. They'll be on rotations. They'll be taking call. They'll be seeing patients up on the floor, doing rounds with the attending physicians, and also doing some studying, because they'll be studying for their boards in their first year and their third year. So there's a lot of didactic that still goes on in the program, and a lot of clinical that they have to balance those two between clinical and didactic as they move forward.
The education program here at Manatee Memorial is outstanding. We are actually currently working on adding 2 fellowships, which is very exciting. It's going to add depth to our internal medicine program. So I'm really excited at the progress that we've made over the last several years. And we are currently completely filled with regards to positions, and that's a pretty exciting place to be after just a few years after inception. So.
I'm Dr. Rebecca Workman. I'm from Mobile, Alabama, and I went to medical school at LECOM in Bradenton, Florida.
My name's Tian Davis. I'm from China. I went to LECOM in Bradenton for my medical education.
I just studied an osteopathic degree in medicine. I'm in a family practice residency program now.
I studied osteopathic medicine in LECOM.
Family practice is a great program where we treat all ages from birth to elderly population, and basically we see people typically in an outpatient setting in our clinic, do a lot of preventative health care, and take care of the patients out in the clinic as well as in the hospital.
The experience is awesome. We have great faculty members who's very involved in teaching, and our training experience is fantastic here. We do have also a fantastic mentor system. A few of our IM internal medicine faculty members and program directors are involved in our daily training and also our direction of developing skills in clinical setting, as well as our caring for patients in bedside manner was all in their parameter of teaching. The experience of supportive staff and including the administration of the hospital has been very positive and supportive.
You know, medicine is a high calling. It takes a lot of work and a lot of sacrifice and many, many years of studying, but the patients make it worth it. I really, really enjoy the relationships that I have. I appreciate that my patients trust me, and I just really enjoy caring for them. So it's just a long, hard journey, but it has good rewards.
For students, my advice would be do your studying while in your school well. Be prepared to have excellent training here and be proactive. Learning is an active process. So do your part of the work and we will do ours.
I want to welcome everyone here this morning. My name's Kevin DeLallo. I'm the CEO of Manatee Memorial, and just want to welcome everyone here for our, I guess it's our third white coat ceremony. Pretty exciting how it's moving along so quickly. I can remember our first, and I see our third-year residents here, which I'm sure you remember your first as well. So welcome everyone today. Just a few acknowledgments as we start off. I see a few of our distinguished board members here and some of our county commissioners. So I want to introduce John Chaffee as our county commission. Larry Bussell is here also as our county commissioner. Our representative, Jim Boyd, who is also one of our board members. Mark Goodson, one of our board members. Dr. Bensi, sitting in the back of the room, one of our board members. And Dr. Kathy Cooper, who is on our board as well. And I know she's here. There she is. She's hiding out. Let me go through the room here to see if I have any other dignitaries. I have many dignitaries in the back of the room, but you'll get to meet some of them later on. What I wanted to do is just share with you today. I went back in my files today just to look at some of the references that we had as far as white coats and what we've done in the past. And I found a letter from a physician from Bangor, Maine, who, after 25 years of being a family practitioner, his daughter got into school and decided that he would write some words of wisdom to his daughter that she was going to start her residency program. So I pulled out the letter, and I just wanted to read some of the words of wisdom that Dr. Eric Steele, who is a physician in Bangor, Maine, wrote to his daughter when she went to residency program. There are a couple of bullet points, and I'll just pick off some of the bullet points as we go through, but I thought they were very pertinent, germane to today's discussion and today's ceremony. But the first thing he lists is, he says, listen to the moms when they tell you that they know there's something really wrong with their child. Even when they seem they're alarmist, they are often right, not because they know a lot about illness, but because they know a lot about their children. Number 2, he wrote, don't tick off the nurses. Actually, this piece of advice comes from your grandmother, a nurse. Without nurses watching like hawks, you and your patients are hanging out on the clinical limb. You want nurses telling you what they think, making sure you order the right dose and medication, and willing to insist you pay attention when they think they are missing something important about the patient. He says, wash your darn hands. We in healthcare are killing patients with our carelessness and it's a critical task that we do. Remember that being a doctor does not make you a great spouse or parent or even a great person. Those are different jobs, requiring different skills, and your white coat is at home is just another piece of laundry. The world is not your operating room, it's not your stethoscope, and the stethoscope is not the key to your entire kingdom. And finally, always remember how proud we are and that you place your stethoscope over a patient's heart The hands of your father, grandfather, and your great-grandfather are in there gently on yours. I think important points that a father relates to his daughter and also that we relate to you. Again, we are so proud of what's happening here today. I kind of lose count of how many people that we have in our residency program, but it really is something that Manatee Memorial should be very proud of as we move forward. So I ask you today, as you don your white coat for the first time, that you take a second to think about the first step you take after placing your white coat on. And realize that this is the first step on a journey that will be exciting and frustrating, but will be the most fantastic journey you will ever take. I think I speak for all the faculty and welcome you on this journey. Congratulations, everyone getting their white coat this morning. Now I'm gonna ask Dr. Cooper to come up and introduce some of our new residents, and we're gonna hand out some white coats. So we're gonna have Dr. Grubb come on. Dr. Grubb, you want to come up and help me out?
We're going to start with family medicine, but before we go there, I just want to let everyone know how diverse our class is. I mean, these don't just represent our local LECOM. We have physicians here from 16 medical schools across the country, which I think is pretty impressive. So I'm really glad to kind of see the melting pot as it moves forward. So I'm really glad that our program is attracting people from the other corners of the U.S. It's been my privilege to be a part of this program from its inception. So I'm very proud as we move into our senior year with our residents that started in the beginning with us. So this is a monumental year for us, and we will have our first real official graduation of our seniors in either late May or early June, and I'm looking forward to that ceremony. And I'm just so proud to be a part of the program here. We have an amazing community. We've been very supported by the community. And to see the physicians, the medical staff here come together in an area where teaching, was a foreign idea, and to bring graduate medical education to the Bradenton area has just been a huge honor, and the people that I've been able to work with along the way and the encouragement I've gotten, I just can't tell you, how blessed I feel to be part of this program. I'd like to thank my program directors who are here today, Dr. Ron Grubb and Dr. John Peters. Without them, the work doesn't get done. They represent, two of the arms of the program outside of the transitional year. I have my assistant director of medical education here, Dr. Radcliffe, and he's in the back, and I thank him for helping in whatever is asked of him. And then we have Ken Nayez, who is my administrative arm, and is Rosa here? Rosa is not here. She's the mom, so I guess she's doing mom duties still. So our graduate medical education has expanded, and the people that we have working for this program in trying to enrich it every day are just phenomenal, and I couldn't be prouder to work with all of them. So we have a lot of names to get through, so I'm going to go ahead and start. We're going to start with family medicine. I'm going to start with Dr. Lauren Frazier. Where is Lauren? Oh, there she is. So Dr. Frazier is not new to us. She actually was here for a traditional year and then decided family medicine was her passion. So we are so glad to have her stay along with us for the family medicine program. She's from Atlanta, Georgia, and she graduated from Lincoln Memorial University and DeBusk, did I say that right? College of Osteopathic Medicine. She completed her undergraduate studies at Furman, where she majored in biology. So, Dr. Frazier. Dr. Alfano, Anthony Alfano. Anthony has more energy than any person I've ever met in my life. He's awesome. He's from Rockford, Illinois. A graduate of Lee Com here in Bradenton, Florida. Has actually spent some time in my office, so I know Anthony well. So graduated at North Illinois University, studied biology, and we're glad to have him as part of our family medicine program. Dr. Grubb doesn't like the spotlight. Okay, Dr. Jennifer Arbel is from Tucson, Arizona. She received her Bachelor of Science degree in microbiology, as did I, at the University of Arizona, and graduated from Ohio State University with a master's in human anatomy. She's a graduate of Rocky Vista University College of Osteopathic Medicine in Parker, Colorado, so we're glad to have her. Perfect fit. Okay, Dr. Cassandra Hafner. Cassie is from Custer, South Dakota. I don't think we have anyone else from Custer. She graduated Minnesota State University. She earned her degree in human biology and chemistry. She's a graduate of Lake Erie College here in Bradenton. She's been in my office too, and she's my neighbor. So I'm going to be keeping a close eye on her. All right, Dr. Claire McGill, wearing Miami orange today. She's from West Palm Beach, Florida. She completed her undergraduate studies in biological sciences at Florida State University. And she's a graduate of Lincoln Memorial University DeBusk College of Osteopathic Medicine. I think orange and green look better on you. So, Dr. McGill. All right. So now to internal medicine. We're going to start with, well, we're not in alpha order. Okay, I'm going to have to make myself. All right, Dr. Bauer, Catherine Bauer. She's from Beaufort, Missouri. Yes. She's a graduate of the University of Notre Dame, where she received a bachelor's degree in biological sciences. She graduated from Lake Erie in Erie. So she's a northern girl. Welcome.
Thank you.
All right, let's see here. All right, Dr. Jason Lakatos. Did I say that right? Yeah. Okay. From Royal Oak, Michigan, he completed his undergrad studies in human physiology at Michigan State University. Graduated from Toro University, Nevada College of Osteopathic Medicine. Okay, Dr. Andrew Murray. He's from Dayton, Ohio. Completed a traditional rotating internship at the Kennedy Health System of the University of Medicine and Dentistry in New Jersey. And he received his Bachelor of Science in Biology from Ohio University. And he graduated from Lee Com here in Bradenton. And he will actually come forward with advanced standing. So, welcome. All right, Dr. Sean Nonamaker is from Tampa, where I grew up. Completed his undergraduate studies in biomedical science at the University of South Florida, and he graduated from Lee Com here in Bradenton. And then Dr. Ishmael Sograti is from Kansas City, Missouri. Completed his traditional rotating internship at St. Lucie Medical Center, received his undergraduate degree in cell biology from the University of Kansas. And he graduated from Kansas City University, Medical and Osteopathic Medicine, Biosciences, Kansas City, Missouri. So let's see, did I get everybody there? Okay, good. All right. Oh, did I mention Dr. Peters will be coming up to put those coats on? Sorry, John. Did I miss somebody? Who did I miss? Okay, we're on to traditional. All right, this is the big group. So These are our first years that will only be staying for a year, so we get to know them, and then we have to tell them goodbye. So, but we will help them along their journey into other specialties like dermatology and neurology and nephrologies and all the ologies. So we're going to start with Dr. Savitha Bomthala. She was born in southern India and raised in Texas. She completed her undergraduate studies in finance at the University of Texas in Austin, and she received a Doctor of Osteopathic Medicine and a Master's in Public Health degree at Torrey University College of Osteopathic Medicine in California. She's an ANSI Carter Global Health Fellow, one of 4 women medical students chosen in the U.S. to aid medical clinics in rural Uganda. So that's pretty impressive. All right, Dr. Joshua Chacon. Oh, he's right here. You didn't have far to go, okay. He's from Caracas, Venezuela. He received his Bachelor of Science degree in Exercise Science from Brigham Young University, graduated from University of North Texas Health Science Center, Texas College of Osteopathic Medicine. It's going to be a long list here. Y'all going to let John do it all? Okay. Dr. Jason Eskew. Dr. Eskew is from Cleveland, Tennessee, received his Bachelor of Science degree in Biochemistry and Cellular and Molecular Biology from the University of Tennessee. He graduated from Lincoln Memorial University DeBusk College of Osteopathic Medicine. There's a few of you guys here. Yeah, I think they caravan down. Dr. Jason Feldman grew up in Rochelle, New York, and Scottsdale, Arizona. Okay, so he's diverse. He's a graduate of Arizona State University, where he received his Bachelor of Science degree in kinesiology with an emphasis in human physiology. He graduated from Arizona College of Osteopathic Medicine of Midwestern University. That's a mouthful. Thank you. All right, Dr. Brittany Grady. She's from St. Augustine, Florida. She completed her undergraduate studies at Florida State University in exercise science. Dr. Grady graduated from Lincoln Memorial University DeBusk College of Osteopathic Medicine. A lot of Seminoles this year. All right. Go you, the you. Okay. Dr. Samantha Harris. I got my Dr. Dowdell from the U, so I got some support in the office. She's from Granbury, Texas. She completed her undergraduate studies in biology from the University of North Texas and graduated from Lincoln Memorial University DeBusk College of Osteopathic Medicine. Dr. Matthew Hasley from Fort Benning, Georgia. Okay, where'd you grow up?
Daphne, Alabama.
Okay, grew up in Alabama. Received his Bachelor's of Science degree in biology from Spring Hill College in Mobile and graduated from Philadelphia College of Osteopathic Medicine in Suwanee, Georgia. Awesome. All right, Dr. Brooke Johnson is from Horton, Michigan, completed pre-medicine studies with an emphasis in applied biology at Ferris State University, and she's a graduate of Michigan State University of College of Osteopathic Medicine. Dr. Casey Combe is from Williamsville, New York. She received her Bachelor of Science degree in Life Sciences and Health Policy Administration from Penn State. She received a master's degree in education from the University of Hawaii, which is where I would go if I got a master's. And she graduated from the New York College of Osteopathic Medicine, New York Institute of Technology. Dr. Amy Lee. Born and raised in Sacramento, California, she completed her undergraduate studies at UCLA Los Angeles in physiological science. She graduated from Western University Health Sciences College of Osteopathic Medicine of the Pacific. Awesome. All right, Dr. Christina Marcellisi is from Tampa as well. She completed her undergraduate studies in zoology at the University of Florida. Okay, I had a gator in there. She graduated from LECOM here in Bradenton. All right, Dr. Ian Matthews grew up in Leavenworth County, Kansas. received his Bachelor of Science degree in Life Sciences from Kansas State University, graduated from Kirksville College of Osteopathic Medicine, and he is actually a member of our United States Air Force, so we'll be continuing on in the Air Force after here. And OBGYN, right, okay. All right, Dr. Mary McPhail Ciufo. I knew I was going to mess that up. Okay. And she's from Ypsilanti, Michigan. Did I say that right? Ypsilanti. Ipsilateral, Ypsilanti. She completed her pre-med studies in biology and chemistry at Eastern Michigan University and graduated from Michigan State University College of Osteopathic Medicine. You're also military. What branch? Air Force. Got another Air Force, all right. Brianna Nest is not here, but I just want to recognize that she's one of our first-year interns, and she completed her bachelor's degree in Milwaukee and graduated from LECOM here in Bradenton. Dr. Kayla Roletter. Did I say that right? Oh my gosh. Born and raised in Meadville, Pennsylvania, she completed her pre-med studies in chemistry, psychology at Gannon University, and graduated from LECOM here in Bradenton. Dr. Roberto Rolon. Yeah. Is from Harleysville, Pennsylvania. Completed his undergraduate studies in biology at Messiah College, Grantham, Pennsylvania, and earned his master's degree in medical science from Drexel University. And he's a graduate of PCOM, Philadelphia College of Osteopathic Medicine. Dr. Matthew Rossman is from Ocala, horse country, but he never owned a horse. Received his bachelor, that's actually true. He received his Bachelor of Science degree in molecular biology from Florida Institute of Technology, and he's a graduate of Nova Southeastern College of Osteopathic Medicine, which is my alma mater. So welcome. Dr. Monica Van Acker is from Lansing, Michigan. Received her Bachelor of Science degree in medical technology from Michigan State University and is a graduate of Michigan State University College of Osteopathic Medicine. All right, Dr. Mallory Wathier was born and raised in Bridgeville, Pennsylvania, completed her undergraduate studies in biology at the University of Pittsburgh. She graduated from Lake Erie College of Osteopathic Medicine in Seton Hill. Awesome. And I'm sure this person's used to be calling last, Jennifer Zimmerman. We should start with the Z's sometime, just for the Z people. From Bainbridge, Georgia, she completed pre-med studies with a concentration on psychology and Christianity from Mercer University. She's a graduate of Philadelphia College of Osteopathic Medicine in Suwanee, Georgia. So this is our first year incoming class of family practice, internal medicine, and transitional interns. So I'd like to thank all of you guys for coming today for our white coat ceremony. There are some refreshments in the back. Feel free to mingle and meet one another. They do have this weekend off, except for the house officers that start on Sunday night. So once we are done with that, you are free to enjoy your weekend and come rested on Monday. Oh wait, who are my co-chief interns? Okay, to be announced. Dr. El Masri walked in. I want to recognize Dr. El Masri, who is very involved in the program, and without him and his partner, Dr. George Hernandez, we would be floundering. So thank you for coming, Dr. El Masri. So enjoy. We're done. Fini.
All right, my name is Ian Matthews. I went to the Kirksville College of Osteopathic Medicine in Missouri.
I'm Kayla Roletter, and I'm from Meadville, Pennsylvania. I went to LeComm here in Bradenton, Florida.
My name is Anthony Alfano. I'm from Illinois and went to medical school in Bradenton, Florida.
So I just graduated from medical school, and I'm about to start my residency here at Manatee Memorial Hospital.
So I rotated through here, love the residents, love the faculty. The attendings are great, really great atmosphere. I felt very welcome. I never felt kind of like I was being put down or below anybody else. So yeah, it felt like it was a great place to learn, just a good cultural environment to learn in.
I haven't been here too long. Obviously, I've been here about a week now, but so far everyone seems very friendly. The hospital seems great. Everyone I've run into is very helpful and nice, and the facilities seem very, very nice.
I think there's a lot of good teaching here. It's definitely a good program. There's definitely a lot of interesting cases and a lot to learn from all the peers and doctors here.
Medicine's a long, long road to get there, and then it's lifelong learning after that. So it's something that if you want to do this, you have to say, am I willing to put in years of study and then continuing education? Just you want to work as a team, and you just love to learn. That would be kind of the things you have to look for in yourself to see if that's what you want to do.
It's definitely a long journey to get through medical school and get to this point, but you just really have to take it one step at a time. And to be honest, the last 4 years flew by. I feel like I just walked through the doors to start medical school, and here I am, a doctor and ready to start residency.